As doulas, we dedicate our time and service to our clients, our communities, and the world. I know many of you probably think that in the grand scheme of things, with everything going on, why is fighting for doulas in hospitals so important? The truth is that violence and verbal abuse against women in labor is all too common. The truth is that there are countless care providers, doctors, nurses, midwives, and more who are dedicated to their patients' right to informed consent, who are dedicated to their patients' overall human rights. But there is another truth. There are some care providers, nurses, doctors, midwives, pediatricians, who do not stand up for their patients' rights. The truth is that there are instances regularly of verbal abuse and physical abuse. The truth is that women are subjected to unconsented vaginal exams during surgeries. The truth is that there have been instances of women begging their doctors or their nurse or their midwife to stop giving them a cervical exam. And those desperate pleas have been ignored. The truth is that there are cases where sexual assault survivors are not treated with the respect and dignity that a survivor deserves. We have been asked to sit in parking lots and wait when we have the tools and the knowledge to advocate and protect our clients. So we need your help. Not every family wants a doula. Not every doula feels comfortable going to hospitals, and that's okay. But what is necessary here is for families and doulas to have the choice. There are some families who either experienced a sexual trauma, suffering from PTSD, or have even been abused in labor before. And asking them to go into a hospital where they've last met their abusers, possibly, without someone to be able to stand up for their rights, is wrong. Countless doulas across the globe are desperate to help our clients, and we need your help to do it. We need you to write letters. We need you to send emails. We need you to make Facebook posts. We need you to demand that the powers that be change policies so that families have their rights given back to them. Their rights to be protected. Their rights to make sure that abusers don't have the final say. And we must hold them accountable. Someone needs to be in the room to hold them accountable. And doulas are one of those people. Nurses, doctors, and midwives and other care providers are also sometimes those people who hold their colleagues accountable. Sometimes a partner can hold their partner's care providers accountable, but oftentimes they do not have the knowledge or experience to be able to have the confidence that is required to be the best advocate. Some of you may have seen that I did a video recently where I created a new hashtag called #ConsentProtector. This hashtag is to help build up the care providers who are standing up for their patients' rights and who are encouraging informed consent. And I'm encouraging other doulas, patients, clients, families, everyone. If you know a care provider that encourages informed consent and stands up for their patients' rights, share a picture of them and use the hashtag. I want to make them famous. I want to drown out all those negative voices with all the positive ones. We as doulas get to see our clients' care through more than just what is written down on a piece of paper. We know their stories. We text with them and call them periodically and just talk about life stuff sometimes. And it gives us a perspective that the care provider often doesn't have. I had a care provider ask my client, "Is this a rainbow baby?" Not realizing that she'd had multiple miscarriages before. And it brought a tear to my eye because I was really glad that someone in the room knew the trials, the tears, the struggle that came to holding that baby. I've had a client who was a recovering drug addict who was mocked and teased by her care provider that she should just get the medication and stop punishing herself, tempting someone who is in recovery. I have had instances where the care provider was not patient with a stressed out father and threw her hands up in the air and walked out of the room saying she didn't have to deal with this. Well, let me tell you, they do. It's their job to deal with you. It's their job to explain every part of a procedure and why they are recommending it. And if they don't have the energy to do so, then they need to find another line of work. We need your help. Help us protect our clients. Help us advocate for our clients. If this is something that you would like to do, if this is something you would like to help with, go to my website at voicesofeve.net/COVID. There you will find a variety of resources that you can share. There's also copies of letters to government officials and to news organizations and to hospitals. I encourage you to use those as starting points for your own letters. Thankfully, we have seen in many states and many hospital organizations that clients and patients and other individuals reaching out to these places does make an impact, and we must keep building that momentum.